I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to today's episode of IDD Health Matters. Our topic today is the burden and impact of tardive dyskinesia in people with intellectual and developmental disabilities. This podcast has been sponsored and is co-developed by Neurocrine Biosciences, and our speaker today is an employee of Neurocrine Biosciences. And I'd like to introduce to you today our speaker, Dr. Sharon Cahoon-Metzger. Welcome, Sharon.
Thank you, Craig. It's a pleasure to be here today to discuss both the burden and impact of tardive dyskinesia in people with IDD. It's essential to highlight this issue to underscore the significance of addressing tardive dyskinesia in people with IDD. This is a topic that often hides in the shadows of supports and services, but it's crucial to bring it into the light as tardive dyskinesia is frequently underrecognized and underdiagnosed, yet its impact on people with IDD is substantial.
I couldn't agree with you more, Sharon. So, Sharon, tell us, what is tardive dyskinesia?
So, great question. Tardive dyskinesia, often referred to as TD, can be characterized by abnormal, involuntary, and repetitive movements of the face, tongue, jaw, trunk, or extremities that are associated with prolonged use of dopamine receptor blocking agents. Some examples of these medications include both first and second generation antipsychotics and gastrointestinal medications such as Reglan or Phenergan.
So Sharon, I know that there are some risk factors for tardive dyskinesia, or TD as we're going to call it for short. Can you tell us what some of those are?
Sure. Some risk factors associated with increased risk for getting TD include increased age, postmenopausal women, anticholinergic treatment, higher cumulative dose, and potency of antipsychotic medications. In addition, people with IDD are at higher risk due to complicated medical backgrounds and higher use of these psychotropic medications. Older adults, that is 60 and older, can develop TD even with a very short exposure to antipsychotics, as little as 1 month, and even when treated with lower doses. Additionally, the increased risk of TD is even more relevant in the people receiving supports due to the use of antipsychotic use that we often see in these people. So for people who are on antipsychotics, it's imperative that we regularly monitor them for abnormal movements so that we can recognize and treat TD early.
That makes a lot of sense. So Sharon, what do these movements look like? What should we be looking for in people that are at risk?
Good question. So TD can happen in any part of the body, particularly skeletal muscles. It's important to keep in mind there's over 650 skeletal muscles in the body, and literally any one of them can be impacted by these involuntary movements. The signs and symptoms of TD typically include classical orobucolingual movements, such as tongue twist.
Mouth movements when you say that? Yeah.
Right. So tongue twisting, tongue protrusion, lip smacking or puckering, along with chewing or clenching jaw movements. These abnormal movements of the facial muscles may also be accompanied by choreic or dance-like movements in other body parts. These can manifest as abnormal movements of the fingers, which can resemble piano playing, grasping, flexion, extension of limbs, foot tapping, etc. Really, any skeletal muscle can be impacted. TD can also occur in the trunk, where an individual would display rocking or twisting movements or shoulder movements, pelvic thrusting. As there are countless ways in which these involuntary movements can present, it's important to closely monitor and assess all people with IDD for these TD symptoms.
This really can make it pretty challenging to diagnose when you have so many different presentations, and especially when we are looking to try to identify these symptoms in people that maybe sometimes already have some other movements. It can make it kind of challenging to differentiate between all of those, it sounds like. So can you tell us a little bit more about the impact of TD?
Absolutely. So TD can extend beyond just the presence of abnormal movements. In a real-world prospective screening study that our company did called ReConnect, we assessed the burden and the impact of TD on individuals who were treated with antipsychotics in an outpatient psychiatric practice setting. In this study, we found that more than 40% of those individuals reported that their abnormal movements had some or a lot of impact on their ability to continue their usual daily activities, talk, be productive, and socialize. Additionally, more than 3/4 of the patients affirmed that they felt self-conscious or embarrassed about their involuntary movements that were consistent with TD. These feelings can exacerbate existing psychiatric symptoms and contribute to stigmatization and social isolation.
Yeah, I would second that. And that's something that we talk about a lot, concern about social isolation and the need to be more integrated into society.
Absolutely. So in addition to assessing the impact of TD on these individuals, the same study sought to better understand the burden of that on caregivers as well, including family members and friends. And in this study, they found that patients' involuntary movements had an impact on the caregiver's life across functional, social, and emotional dimensions. Along with the time spent managing the patient's movements, caregivers reported an impact on their productivity, their socialization, self-care, and ability to continue their usual activities.
So it really affects more than just the person themselves.
Absolutely.
Yeah.
Overall, this ReConnect study demonstrated the far-reaching effects of patients' involuntary movements consistent with TD. Recognizing and treating TD early is therefore obviously very important to alleviate the considerable burden on both the patient and their caregivers, their supporters.
Yeah, sure.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So, is there any difference in people that are older or younger, or are there certain impacts that we should think about regarding TD in older people?
Excellent question. As you can imagine, TD's impact on the various body regions can pose significant challenges, particularly for older people. For example, when people experience abnormal facial movements, such as grimacing or increased blinking, the embarrassment they may feel may lead them to avoid dining out, going into commons areas, participating in social activities. This fear of judgment or ridicule can contribute to social isolation, becoming a genuine concern for people dealing with TD. When they have repetitive piano-playing fingers, People may need continuous assistance from supporters, as they may not be able to hold a utensil or feed themselves or button up their shirts to dress themselves. This can impact their independence and their self-esteem. Tardive dyskinesia can also cause people to have difficulty swallowing, which could lead to safety hazards such as choking or increased risk of aspiration.
And I'll tell you, aspiration is already at an increased risk for people with intellectual and developmental disabilities. So this is really significant here.
Absolutely. And furthermore, older people with uncontrollable movements of the legs or toes may have difficulty walking, which would not only require assistance with their ambulation, but also put them at higher risk of a fall. For this multitude of reasons, recognizing and addressing the substantial physical, emotional, and social impact of TD is essential to providing more holistic approach to TD care in both young and older.
Yeah, that certainly makes a lot of sense. And it's great that you're here sharing this information with everyone who's out there listening. So do you have any case reports about TD that you can tell us about?
Sure. I'd like to actually share a couple stories if we have time. So,
yeah, sure.
Awesome. Okay. So these case assessments really illustrate the burden of disease on patients. Through these narratives, we'll explore the appropriate diagnosis and management and how that can make a positive impact on these patients. Right. Our first case is about a person who has TD and uses a wheelchair for mobility. The challenges of moderate hand movements and significant facial and lip movements were evident in this individual. Holding utensils and self-feeding became difficult, often resulting in wearing her food rather than being able to enjoy her meal. This struggle caused her to feel embarrassed, and she eventually chose to eat alone in her room and avoid the dining room altogether. The uncontrollable finger movements also interfered with activities that she once really enjoyed, like playing bingo and participating in arts and crafts, which pushed her further into this isolation. When she saw her physician, he began the process of diagnosing and treating her TD according to TD guidelines. And this marked a profound turning point in her trajectory. We witnessed her transformation, and it was really, truly remarkable. She now confidently goes into the dining room, feeds herself, better participates in all these activities that she previously loved. She even shared with me the joy she finds in putting on her makeup. That's such a simple act that we take for granted, but it signifies this regained sense of independence and pride and renewed quality of her life.
What a great story with a really good outcome, and it also brings to light again some of the challenges, because we know some people with IDD do have other challenges with movement sometimes. So it's always good to try to tease out, is this TD and can it be improved with appropriate diagnosis and treatment? Do you have another case?
Yeah, absolutely. So the second case is an older gentleman with TD. He had prior antipsychotic exposure and presented solely with lip smacking. That was his only clinical presentation. But this loud lip smacking sound posed a unique challenge for him and the supporters in his home. Since others would complain about the disruptive noise of the lip smacking, he would have to be removed from the shared room. This not only subjected him to constant feelings of isolation and embarrassment, but it placed a burden on the supportive resources. After taking a careful look at his medication history and presenting symptoms, we recognized that his behavior was a manifestation of TD and addressed it. With the use of the first-line treatment, which are VMAT2 inhibitors, both the lip movements and the lip smacking sound eventually softened, which, of course, was a great outcome for both him and those sharing his space.
Yeah, and that's another good story about how it impacts not just necessarily the person, but others around them as well.
Absolutely. Yeah. So, it's not just the symptom control necessarily, right? It's also restoring the dignity, the independence, and the social engagement for individuals with TD.
Love that. So what can we all do to enhance our ability to recognize and improve the management of TD in people with intellectual and developmental disabilities?
Excellent. First, teamwork is paramount, and everyone shares the responsibility of identifying the symptoms of TD. If you see something, say something, and bring it to the attention of a clinician. Early recognition of TD is a collaborative effort, and each member of the team plays a crucial role in addressing and mitigating the impact of TD. Second, you can take advantage of available tools and resources. Neurocrine Biosciences, my employer, offers a website called mind-td.com. And that website holds a compendium of educational resources to facilitate the identification of TD. Additional resources can also be accessed on the Neurocrine Medical website at neurocrinemedical.com, which features educational podcasts, videos, and slide presentations.
And I visited the website, and there is really a lot of great information there. A lot of great information. For instance, if you are working in a program and are looking for materials to help train other staff about this, great resources there. So I highly recommend that you check it out. So as we come to the end of this podcast, Sharon, I really hope that everybody here has gained a deeper understanding of the profound impact that tardive dyskinesia can have on physical and emotional and social well-being in people that we all support. Early recognition of TD symptoms is really, truly pivotal in our collective efforts to help address and mitigate the long-term impacts of TD in people that we support. So let's everybody work together. Let's continue educating ourselves and other supporters and ultimately strive to enhance the quality of life for everyone that we support. Thank you so much, Sharon, for joining me today on this important and sharing this important information about TD and what we can all do to improve recognition and diagnosis.
Thank you.